So can Grace give it, can the hospital give it, and how in the heck do you coordinate that?
Exactly. So now, I was telling you about the plan, 1B. 1B was for, 1B was for long-term care facilities. They broke it out. Originally, the way it was all explained to me, and this is back in July and August, was that, Tom, when we get ready to do the vaccine distribution, the vaccine for the county is going to one central distribution point. And in Cowley County, you are the guy. It would be coming to the health department, and you will coordinate with all of the other providers and track it. You'll give doses to the hospitals.
Okay.
You'll give doses to the other providers, the health center, all of that. There are too many voices in Topeka. I lived there.
You know.
I know.
Yeah. So,
Hospital Association says, no, you can't do that.
oh,
You can't do that. You must send it immediately to the hospitals. Okay. So all of a sudden you start getting all of these different. Now, I'm not talking politics, body politics, believe me. But when you mix politics and public health, you are creating a recipe for disaster. We spend so much time crafting these things, and we know that they will work if you allow us to do it. It's when you sit in there at the last minute and decide, oh, I think I know better than you. And now, instead of me sending it just to one central point in each county, like we did for all those years that I was there, you have an aide from the governor's office that says, well, you know, they make a valid point here, and we like the hospitals, so we're going to send it some directly to the hospitals. So that's why one morning I saw an email and my eyes about fell out of my face, and I get on the phone and I'm like, Ben, I'm hearing a rumor that you've got vaccine. Yeah, we had 145 doses arrive yesterday. And I'm like, well, thanks for telling me.
yeah.
You know,
Why didn't they call you and tell you?
it's like, you know, and I'm like, because we had everything ready.
Yeah.
We knew, you know, we
were ready to go.
We were ready to mix it, dilute it, distribute it, the whole bit. And I'm like, fine, I don't have time or the energy to argue about it. Just make sure it gets where it's supposed to go, follow this, and so forth. And so what's happened is, and I'm so angry with KDHE right now, because they've done our county wrong. They have not provided us enough vaccine to effectively get everybody that we need to in the community, in that Group 1A. They absolutely ignored the second hospital in our community. And I don't care where you live, that's wrong.
Mm-hmm.
That is wrong. It doesn't matter that William Newton is sitting here and we thought that was the hospital down there, and you forgot that South Central Kansas Medical Center sits just 10 miles down the road, because they serve a big portion of our community. And in that respect, they thought they were in Andover.
Oh, good grief.
Yeah, and so
And that
they
was the
messed that
excuse.
up.
We
really.
thought we thought that was in Andover.
It's like, no, it's our city.
So
Well, back to letting you coordinate.
right. So basically, I
Yeah,
didn't.
he does know where
Yeah.
South
Yeah,
Central
let
Medical
him-
Center
So,
is.
but you see, that's part of that whole.
Yeah, it's a
It-
mess.
It's been a mess. I mean, it really is. You know,
Gosh.
you think of a barrel of monkeys and all that kind of stuff.
And imagine states like New York or
Yeah.
Yeah.
Massachusetts.
It is incredible, but we are seeing more, and I think to this point in time now, there have been between 800 and 1,000 doses that have come into the county, and of that, a good 90% of those have been administered already. We're expecting more next week, but I don't know how much. And then we're going to have the second round that will follow up what we've already given, that they are already holding, so that we know we're going to get that. Because my biggest concern was, what's going to happen if I give this to somebody and I don't have it in a month? How can I do that?
You mean you won't, what if you give it the first
And
one,
then I
but
can't
you
get a
don't
second.
get the
Yeah.
second one to
Right.
give to
Because
them?
I don't have it.
Because
It's like,
they need it in a prescribed
Yeah.
time.
So
Yeah.
those are the pressures that I know they're facing, and they're real.
Yeah.
And I know that there are a lot of places, a lot of people that want it. The residents of Cowley County have been calling me, and I will not give them a runaround. I will tell them the truth. I'll tell them, no, I can't give it to you yet, but I will take your name. So when you see the list, yeah, when you hear about the list, that's what that is. So when it is several pages long.
Yeah, I'm sure.
Now, here's another reason, and you might hear this, and I'm going to share it with the public because I don't have anything to hide. The government tells me you will follow this protocol, and I say yes, I will. I'm a good guy. I understand the need to follow the protocol. I know that I know what it's like to have that plan, which means we do the first responders and everybody first. But this vaccine comes in a vial. You've all seen vaccine
Oh, yeah.
vials. I get 10 doses out
It's
of a vial.
10 doses in a
Okay.
vial. Mhm.
The minute I put that needle, that hypodermic in, and I draw out 0.05 milliliters, I have 6 hours to get rid of the entire vial.
Yeah, you have to empty the bottle. Mhm.
It's all got to go.
Mhm.
From the moment that starts,
It's
the
not
clock
good.
ticks. As long as it's sealed and I can keep it either frozen or refrigerated, I have a pretty good shelf life with it. But the minute I take one dose out, I've got to give all the doses. So what we are doing currently is we're lining people up 10 at a time. Okay, because we want to make sure we open it, we give it all. That's part
Yeah,
of
you
it.
don't wanna waste
That's
it.
part of, that's exactly, my overarching goal is we do not waste this at all. I don't want a single dose wasted in Cowley County.
Yeah.
No waste. But here's what happens. People don't show up.
Can you have a backup list?
That's what we've got.
Yeah, you
And
have
that's
to
what
tell
gets me,
them.
and that's what gets me
You
in
might
trouble.
get called, are you ready to jump and come over
That's
here?
how my
And that's-
son got his. He got a
that's how
call
it
from a
works.
health care worker in Lawrence. If you can get out here in a few minutes, we're gonna
Here,
give
we'll
you a
give it to you.
shot.
Yeah,
And-
we got a shot, we can give it to you.
They do, he wanted one.
And I told the state health department, I says, this is how I'm gonna do it. I says, and if you don't like it, come put the cuffs on me, but I
Yeah.
won't waste the dose.
Yeah.
I'm not gonna deviate from the plan. But if I have that list, and I know that I have Pam, and she is 5 minutes away,
You bet.
and I have a dose that I have gotta get in an arm,
Soon.
within an hour or so.
So the doses you have now, any of that going to nursing homes?
No, and I'm gonna
Because
explain
they're not
why. I'm
designated.
gonna explain why they took that away. That was never our responsibility. And part of that, it's okay. It's an enormous job.
Yeah.
They have nurses there and everything else. We had the plan to do it, and if we had the vaccine, we would mobilize their nurses, we would go out, we would send one person to deliver it, monitor it, make sure it was done right, and then we would come back. Basically, we were gonna be the little ants all through Cowley County, going to all these places, and we were going to enlist those trained medical people, because nurses can give the shots.
Oh, yeah.
That's not the problem. It's all the stuff that
Yeah.
goes with it.
Yeah.
That's the problem.
The nursing homes are supposed to receive it directly then?
The
from
nursing homes are going to, they were mandated. Do you remember I used those 3 letters, CMS, Centers for Medicaid Services?
Oh, yeah, yeah.
Oh.
Well, Cumbernauld has notified my mother, she's in an apartment there. She's gonna get her first shot on the 16th, next Saturday, and the
Saturday.
second one on the 30th.
So
So,
they got it
In the
directly.
next week.
so they are.
In the next week in Cowley County, it's
That
going.
is through
that.
CVS, it's through a
CVS and Walgreens were the 2 that were tapped by the CDC to do that.
But it's not everywhere.
We don't have a Walgreens anymore, do we?
pharmacy.
Yeah.
No, we don't.
And where's the closest CVS? I don't even know.
Probably Derby.
Wichita.
Maybe.
Well, I know Wichita and
So what does that do? What does that do
Oh, Webb
to those,
has one.
to those eight facilities
Oh,
in Winfield and Cowley County? See, it puts them behind the 8 ball. They're like, Tom, what do we do? I'm like, okay. So we did talk. I had talked with Darrett at Graves early on, and we tried to get them authorized to step in and do it. Crickets. You know, crickets. It's like, we got a plan. We know how to do it. We know who here
Yeah.
could
You know your
respond.
people.
We do. I mean, I didn't maybe in year 1, but in year 6, I mean, I'm in my 6th winter. I know now how I could get these things done. But yet, so really, what the problem is, I've told people this. This is deja vu for me. Because back in March, when I couldn't test, I felt helpless. In January, when I don't have the vaccine, I kind of have that same feeling, but I know what's going to change. And so I know. So in the next 60 days, we'll be into phase 2, and that'll open it up quite a little bit. It'll open up quite a little bit. But it's all going to be dependent upon supply. Can they get it to us? I have anticipated that if we were to achieve the necessary vaccination rate in Cowley County, that we're probably going to need about 25,000 doses by the end of the year.
Right.
And remember I said we've got about 500, 800 done so far.
You can see, that's
So
gonna
that's where
take a while.
that's going to take a while.
Yeah, it's gonna
So
take.
as you have the doses that you've received, are they from the same company?
Yes.
Pfizer?
Ours are ours have been from Moderna.
Moderna?
The reason we didn't choose Pfizer is because we didn't have anything that could freeze it to minus 60.
That's right.
Our pharmaceutical refrigeration and freezers will only take it down to minus 25. And I could have spent an additional $25,000 and gotten on a list that probably wouldn't have delivered the box to me till June. And I said, nah, that was a business decision.
Yeah, sure.
So I knew that they were coming. So we were delayed about an extra week because of the timing of the new products coming into the market. But that's why.
'Cause I know the hospital here has some Pfizer and some Moderna.
They were able to get it now. See, what happened with that was the fact that the Pfizer vaccine came into centralized distribution points that had the ultra-cold storage.
Storage.
Guess where the closest is? Wichita, in the hospitals. So it went there, and then it was couriered down to the hospital here.
Okay,
Yeah.
once you get the first shot,
Mhm.
there is still, is there still a time period when you are susceptible to getting?
Yeah. I've had it now, and I still am. I mean, the first shot, yeah, absolutely.
So Mary had her first shot last week,
Okay.
and I haven't had mine yet. So if I would happen to get the virus, I could still
Sure.
pass it along to her.
Absolutely. At this point, it's not like 100% guarantee. You know, it is honestly that way. The effective rate that we've seen cataloged for this is phenomenal. 90 to 95% effective, so that you will not get it. And 100% effectiveness, that if you do and have been vaccinated, you will not require hospitalization, and it will not have the kind of impact that this could have.
So you've answered my question. If you've had it, you should still get the
You
vaccine.
should, but
Is
let me explain one of the things and why there's confusion around all of this. It's what we don't know. We don't know about coronaviruses and how long those antibodies will last in the human body.
Right.
It's
Okay?
June.
Because you know what I've been told since I was a little kid? There's no cure for the cold.
All right.
Okay? There's no cure for the cold. But I would really rather say there are so many variants of those 7 coronaviruses out there, and it changes, that it always changes, and therefore you're always susceptible to that.
Yeah.
I do believe that our bodies do have a response to that. Otherwise, why is it some people will get sick and others will not? Okay, you must have had something once upon a time that was so close to that your body recognized that. And think about it. You can be in a family. One person will get something and the other person won't. And you're scratching your head saying, how's that work?
Yeah.
Me.
You with
I
me?
get it.
So those are things that we look at. But here's the other thing. We already have been watching this so close. I know every single person in Cowley County that's had the virus. I don't know them personally, mind you, but I know who they are. I've got the lists. So that when somebody comes, say, Phil, you were to come in and say, Tom, I want to get this. I'm like, okay, I can look at your record and I can see, Phil was sick in July. And I wonder what's gonna happen to him when I give him the shot as opposed to what's gonna happen to Pam, who's never had it? And we've already done it, even in this short time period. And you know what I found? People who have had it, they get that first shot, they have that, oh my God, reaction.
Really?
The arm hurts so bad they can hardly pick it up. They get the chills that night, and the next morning it's gone. Guys like me, I got the shot, no big deal.
Yeah, I didn't have anything.
I got no big deal, and that's why I'm expecting that second shot to be the other for me. Because they already have it in, their system, and that first shot woke it up again and said, hey, here it is. See? So we watch that real close. It's novel, and ergo new, and so we're looking at it.
So after you get the second dose, should you still wear masks?
I
for a
will
while?
probably be doing that for at least a 2-week time period. And here's what I'm doing. Before it all started, you know the antigen tests that I always lament over, because 15 to 20% of my numbers now are antigen tests, and antigen tests basically look backwards in time, not the snapshot of today, and they cause, again, a lot of noise. But they have a purpose, and they have a really good value to me now. Because now I can take one of those and see, did you have this? And I took one before I did this, and it was clear as a bell. Not infected at all. Okay? I get past 2 weeks past that second shot, I'm taking it again. And I'm expecting those markers to show up, because my body will now have the antigen in it. Just as if I had been sick.
So I think we need to develop new masks. I've had
I've
two
had
doses. I don't have to wear a mask anymore.
What's gonna go on? See, I got the little I was vaccinated deal.
Yeah.
Is an antigen test the same as
We'll
an
need an
antibody test?
ID.
Yes.
Oh, I
Same.
got the antibody.
Same. It's called
That would
antigen, but it's
make
a,
you
Okay,
so
So yours is
the antibody
gonna
looks
show-
back. I've never had it.
Yeah.
And honestly, I must confess, I have been exposed so many times since this all started.
Yeah.
I am a lucky man.
Yeah, I was gonna say, that's, well, you
And
must
I have been around
believed-
so many people that have had it. And I was in a meeting one day, and I was presenting, and so I said, guys, I gotta do this, and I took it off. And I am no further away from a person than I am from this nice lady. And then I found out 2 days later, this nice lady just tested positive. And I was like,
You
oh
gave-
my God, what did I do? You know, I'm supposed to know better, I'm the county public health officer, look at what I did, so.
Well, not necessarily.
But it happens, it happens. Yes.
I guess
So
I
you're
thought it
okay.
was supposed to be a good idea to wear a mask until we had almost herd immunity.
That's exactly what it's going to, but you know, we'll go to that masking comment again shortly. Here's what I guarantee you is going to happen. I will be able to convince people to keep the masks on through winter.
Yeah.
Mhm.
And when winter stops and you go back outdoors, those masks are gone. And I'm not gonna be able to stop that.
Well, they are very handy when it's
It's
cold.
when it's cold
because
outside,
They
but
help to make your
that
face
will
warm.
happen. There are going to be that segment of us that will continue to wear it, and there's gonna be that segment of people that say, I just will not do this anymore.
Yeah.
Okay, so I will accept the reality of what is, and I'm going to work on that which I need to work on. And my job right now is going to be the following. I told you about the survey. 60% of the people said they would take it. 40% have the initial resistance, but inside that 40% lives another 25% of our population that said, well,
Yeah.
Maybe later.
They're gonna wait and see.
if it works,
Yeah.
Yeah.
I'll get it.
There you
So
go.
then that's
So
really
that takes us,
85.
that takes us up to that 75, 80%.
Yeah.
And you know what that is?
That's pretty
That
good.
is the norm
Oh.
in Cowley County.
And so you also, maybe using the thing about, do you wanna not have to wear a mask all
Yeah.
summer? Get your dog, get your
Here's
vaccine.
That's a good one.
Here's the thing, and I
That's
and I
a
put this,
carrot. That's a carrot.
when
Good carrot.
November hit, November came with all of what it was showing me. I had to take a look at the vast realization of what would this county look like if we did nothing. It's my job. I get paid to think about the bad things that can happen to us. I did the numbers, and I did them over and over and over again, and I adjusted for the seasons and everything else. And it came out the same way, that in order for us to truly get to a position of effective herd immunity in a population of 35,000 people where the youngest age cohort is least affected, 18,900 and some odd people will have to get sick with this. 18,000 will have to get sick with this. It will take 3 years for that to happen. Okay? So this isn't over. If we do nothing, we're just starting. Okay? Because in reality, the virus didn't start kicking our butts until late October. That's when it announced its presence with authority, and it made its way through. And we will know, based upon what we've seen and what we can project, that in that 36 months, with that almost 19,000 people getting sick, that we would have between 800 and 12,000 people die. Or not 12,000, 1,200, I'm sorry. You know, die from it.
That's a big
That's
sacrifice.
what would happen if we do nothing.
Right.
Because I had to sit there and make the decision, do I have it in me to ride that out?
No.
You know, or will I just throw up my arms and go find a beach somewhere, you know?
No.
So this gives us the tool, finally, to fight back. And there are some other really promising things that are out there now. There is an antiviral that is now available. You can't buy it at the store. You can't get it at the pharmacy. But you can get it through physicians if you have to go to the hospital and if you are in the older age category. And the Bamlanivimab or something. It has a name as long as I am tall. I call it Bam Bam. That's because I haven't had something to remember it by, but this is shown to be really, really effective in shortening it, and I don't want to say curing it, but leaving people with minimal side effects. What we don't know still scares me about this virus. We don't know what's going to happen to you if you've had it for the rest of your life. I don't know. And this virus has shown itself to be very sneaky in that normal upper respiratory ailments stay in the upper respiratory system. This doesn't. This crosses over from the lungs into the bloodstream and then can move, which is why you will have so many deaths that occur after the initial infection, but due to a subsequent issue that arises 10 days to 2 weeks later. We've had a lot of people that have made it through the COVID protocol, and you would think, okay, you're back on your way to recovery, especially in the elder cohort, and they seem fine. And then in the next week they crash. And if they've had any kind of other issues, renal issues, anything else, they perish. It is frightening how it looks. We, like I say, we've learned so terribly much. The tests that we do, there are different types. The PCR test, which, you know, PCR again, it's polymerase, something chain reaction. It's the one that, you know, we go digging. We get the sample. They also could do it with the saliva tests. It's a PCR test, but basically what that does is it puts it into a device that analyzes that in a deal, and it looks at it, Think about a meat cutter. Okay? The sample is the big slab of roast beef or the ham or whatever, and you set that thing to ultra thin. Okay? And you slice it. And you keep slicing pieces off of it as it goes through that cycle. And what it looks for in there as it scans, it looks for that defining PCR, you know, or that little bit of information out there that says, yep, there it is, bang, we know that that person has the virus in their system. That's what it does. I'm really putting this into crude terms, but I have to try to explain to people what these devices do. What we know now is the time that it takes for a device to locate that is connected, of course, to the amount of virus in the sample. And that has an interesting relationship to the individual and their risk of ending up in the hospital or even worse, or in the cemetery. We didn't know any of this in March. We had no idea. We didn't even know how to test for it. And so, you know, like I say, the body of knowledge that we have amassed in a very short period of time will fill volumes. But it's sadly based upon what has happened and all the tragedies that we've had to endure that will prepare us to go forward in the future and make this something that's no longer going to require what I call politely my face diaper and everything else. So we can go back to it and go back to some kind of whatever normal is again. But one thing, and I'll say this in wrapping it up because I've gone way over, and I'm sorry about that.
No, it's
So
very
I
interesting.
talk about this. I do talk about this all the time. The one thing that we've learned, or I hope we've learned, as a community, as public health, and as society in general, is we can no longer depend upon somebody else to take care of emergencies that affect us. We have got to do a better job of being prepared for the things that will happen within our communities and in our nation and things like that. And I point back to the great calamities of life in COVID land, because why did we have an outage on toilet paper? Why were you not able to buy chlorine bleach or wipes in a store? And why would this little tiny mask that I wear on my face that a year ago I could buy for a nickel end up costing $2? And when I needed them the most, why wasn't there somebody in our state or a neighboring state able to manufacture those? And we had to turn to the nation, and I'm not trying to be political, okay, but I had to turn to the nation where all of this began, and I'm dependent upon them to protect you. That is the very first phone call that I had as the public health officer of Cowley County with the senator from our state. It's not even the senator from this district, but he knew me from my time in Topeka, and so they reached out to me and said, "We'd like you in on the call." And I asked him, and I says, "Senator Moran, what are you doing to make sure this never happens to us again? I want to know. Don't just dump money on this. Fix this." And those are questions that we're going to have to ask of our elected representatives. And I mean that. If they want to be involved in public health response, fund public health appropriately, okay? Give us the tools that we need to do the jobs. Hold us accountable. Hold us accountable. Make me prove every year like I do why I am of value. But never forget what we've gone through in this last 9-10 months. I don't want 10 years down the road, when I may be retired and gone, that our people that come after us forget about this and ever take it for granted again. You know, so that's really it.
Well, there's gonna be more of a federal response now.
Oh, there's going to be.
And it's gonna be a whole new world.
It's that the people say, well, what's going to happen? I don't know. I haven't been able to figure that one out yet. I couldn't figure it out in the last administration. I don't know what's going to happen in the new one. I've been in governments long enough to understand that you hunker down sometimes, but what's really bad is when you're in the midst of this battle And I joked about this because this honestly happened in one day. I was accused of performing an unnatural act with the president and sleeping with the governor, all in the same day. So that tells me at least I'm staying in the middle of the road enough that nobody can really tell where those political allegiances lie, you know. And I made no bones about it. I am from Topeka. I know Laura Kelly personally. You know, I did not know President Trump at all, but no, none of those things have ever happened, and it just would absolutely make my head explode every day when I go about things. I'll share one last little glimpse of what my life is, as some people call me the king of COVID or the czar of COVID or whatever it is in the county. And no, it's just that I was the person that came here for a reason, and when duty called, I didn't back away. The best one I had just last week, though, was somebody took the time to take a clipping out of the newspaper that was a story written by John Hanna of the Associated Press, where he was quoting Governor Kelly and the fact that she was pleased with so far the allocation of vaccine to the state and how that was going. No return address, nothing, just the article. And in the margins was scrawled, "Langer, what are you doing? You have to fix this." And I'm like, let me go to the kitchen and cook up some vaccine and see what we can do, you know, because there's really not much else that you can do. So you have to understand that when this is as personal as it is to people, there are going to be responses both ways. I've just always asked people, hey, be neighborly. You know, the one thing is, we all live in this community. We are in this together no matter what. When, you know, somebody would get in someone else's face because they weren't wearing a mask or they were wearing a mask, I just really had no tolerance for that. I always tried to put people in their place. But I will guarantee you too, the minute I walk out the door, I'll take it off as I'm walking down so I can let everything dry out. You know, and I am so looking forward to the day when I might get a permit from Vince over at the fire department, and we'll get a barrel and we'll just invite everybody to come and burn their masks and we'll cheer, you know. But those days are in the future, and they're not here yet. So bear with us. I am hopeful that by the end of this summer, we will have distributed enough vaccine that we will only have had to go through one holiday season as restrictive as this last one's been. Because I didn't see my family. I didn't, you know. And I'll be honest with you, okay? I am human too, and my wife, she works, and we look at each other and we like lock ourselves away. And yesterday morning, she woke up and had a little bit of a cough and said she had a sore throat, and I made her get in line and get a test, and I got one too. Mine would have been a little soon, but I had to know, you know. And I don't want people to take for granted that is there. That resource is there. As long as we're doing what we do. You wake up one morning and you don't feel well, don't wait. Go get the test. Find out. What we're doing now as well, and we have been since the 21st of December, is we are testing you not only for COVID, but we're also looking at influenza. So we know if you've got the flu or if you've got COVID. That's the only two things we'll know. But that's what we would find out. So far, all of this has done something remarkable.
So when can you get a COVID test?
Monday through Friday from the health department at 9 o'clock until it usually goes by the 11. You give a call to the office. Tell them I need to get that, and they'll say, we'll ask you some questions. Do you have symptoms and all that? Don't let my staff talk you out of getting one, because things have changed. Remember what happened originally was you couldn't get one unless you had symptoms. But we still have a lot of folks that have symptoms, and we want them to be tested. But I'm telling you right now, I've been around somebody that I think's had it. I'd like to know if I have it right now. Get in line. All it costs for us is to put the swab in and do the stuff, and then we let you know. I do not have a problem with that. In Arc City, on Saturdays, matter of fact, they're probably doing it right now. It starts at 10. I think they run 10 to 4. In one of the churches down there, they're doing public testing that's not been done by the health department. It's done by an outside contractor, part of the Get Tested Kansas deal. That runs on Saturdays through the end of this month. I've not seen, after the first week still yet, what the results have been. So I'm a little on the fence on that one, but I'm not saying don't use that. So.
Are you saying because of the masks, we haven't had as much regular flu
Exactly.
as we've had in the past?
It is exactly right.
Well,
I knew that.
That's good.
I knew that there were going to be two things that were going to occur.
All the Asians have known that for years.
Okay.
But if we've had our flu shot,
Mhm.
then
That helped with it. You remember back in September, October, I was out there. I was saying, get this. If there was ever a year you needed the flu shot, this was it. Because what we did not want is an eruption of two illnesses simultaneously, and have to fend that out. People have listened enough in the community. Okay, there's three things that happened. People took advantage and got their flu shot. That's the first thing. We had record numbers of people get flu shots this year. Okay, I hope that holds. Number two, even though they were kicking and screaming, okay, they wore their masks. Not everybody, but a heck of a lot more people are wearing masks this year than were at this time last year. Everybody in this room included. Okay, we didn't wear a mask at this time last year. Number three, school was not in session, but virtual. Now, why is that? Flu affects one age group more than any other. Children, pediatric cohort. Those little vectors,
Those little germs.
they go to
They
school.
run around.
They pick that bad boy up and they bring it home.
Yep.
2017. 2017 was our really bad flu year. Nobody even knew who I was then. But I was watching it so close. The estimation at that point in time, in February of 2017, 30% of the county was sick with the flu. I remember telling people, if that happens with this, we don't know what's going to go on. I said, I don't even want to consider it. I mean, that's going to be when you'll have to set up temporary morgues and such. If we had that type of, with all of this that's happened, okay, if it wasn't for the fact that we track this and it's a pandemic, in reality, if I didn't have that number 50 associated with this, we probably wouldn't even be talking about it. Okay, we probably wouldn't even be talking about it. But you put that 50, that's, people know Cumbernauld, okay? March 2017, spring break. We had pretty much gone all the way through. Okay, we were coming out. Flu season was ending. People came and visited mom, dad's Cumbernauld in March. Later that month, we had, I think, 6 associated deaths from influenza in that population. I remember talking with them and we were trying to report it. And you know what? Oh, that's sorry. Oh, we're sorry to hear that. I'm like, I had 6 people dead
Yeah, that's
from
terrible.
flu
That's terrible.
that year in 1 month. Okay, now we're there, you know, and that's why so many people argued with me through this whole thing, and I'm either the smartest person or the dumbest guy that's ever walked, and oh, it's no worse than the flu. I'm like, sure.
Yeah, right.
Until you're 39 years old, you work for the bridge, Road and Bridge Group, you get sick, you end up in the hospital, you end up in a coma, and then you end up dead.
Oh, yeah.
Tell me again.
Yeah, right.
Yep.
Well, I think I can speak for this group. We appreciate you and we appreciate how you're caring about us. And it's not wasted.
No, it's, so many folks don't, you know, stop and talk. And what really is unique, I'm sad that it took this for people to get to know me. I really am, but I'm glad that I'm glad that the community has been as understanding as they are. There are folks that I won't ever get through, and you know, I don't waste the emotion and the energy on that. I just can't. I just can't. I've got too many others that I have to take care
Oh,
of.
yeah, sure.
And by take care of, my job continues to be and will be to let you know everything that I know, to help you make a decision that's going to benefit you in your situation. I'll never force you to do something, but I will sure as heck do my best to convince you to do what I think is correct. And from there on out, we'll all have, a better life again. And this is going to end.
We're glad you do what you do, Tom, and we hope you get enough sleep.
The one
That's
thing,
hard,
the
I'm
one
sure.
crazy thing, and I'm going to talk a little bit before I grab my coat and get you all out here. Phil, the auditors, they always watch the books, and they've always been really concerned when they come in and they look at the health department's books, because they take a look at what the health officer has done and how many hours he's working. I don't get paid by the hour, I get salary, so it doesn't matter, But what happens is I don't go anywhere. I mean, it's been 5 years, and I mean, I have maybe in that 5 years been gone on vacation a total of 3 weeks.
Wow.
And so they keep saying, you gotta do this, you gotta get out. And I'm like, okay, so 2020 was the year that my wife and I were gonna go to the Kentucky Derby. We were gonna go to Florida. We were gonna go to Florida to visit my son and daughter and our grandchild. And then we were gonna take a vacation in the fall. And all three of those things went right down the tubes,
Wow.
so.
That was
It's
not,
just what it was.
yeah.
So anyway, thank you again. I
Thanks
appreciate
very
it.
much.
I chewed up way too much of your
All
time.
right, well, we appreciate your
You're
comments.
welcome. You're
taking
welcome. Is there
questions.
anything else? You guys know how to get in touch with me.
Yeah,
I mean, I will.
we know where you're at, for sure. We
And I
appreciate you
actually do
coming.
want to grab one of these, because my wife was going to come with me this morning,
Yeah, sure.
and she said, I want to find out about this group.
Yeah, here.
So,
Take
Yeah.
a little card.
Yeah, take this card and you can.
and I'll give that to her, and if she shows up, then she'll tell you what I'm really like.
Actually, other than the phone number, to the
Health Department?
county, can we email you?
Oh, yeah. T. Langer at cowleycounty.org.